I'm sure you've all seen this term, so let's talk about the medical provider network. All right, when you first have an injury, it's pretty likely that your insurance company or your employer sent out a notice advising you that they belong to a medical provider network. And what is that? Well, we all have private insurance and we understand what an HMO is, what a PPO is, and that with an HMO, you have to have a primary treating physician who is within that HMO network, who will then act as your treating physician and refer you out to different specialists. Well, the idea is very similar in workers' compensation. You have you have to select one treating physician, so he's called a primary treating physician within the medical provider network, and this doctor will refer you out for things like MRIs, um, if you need to see a specialist like an orthopedic surgeon, if you maybe broke your ankle or something like that, and maybe some physical therapy or acupuncture treatment. And this doctor is responsible for requesting these types of referrals, so an MRI referral, a specialist referral from the insurance company. And as a primary treating physician, that is one of his responsibilities. So no, you cannot, if this is you, right, and you're the injured worker, you cannot refer yourself out for an MRI. You can't refer yourself out to a specialist, and etc. You can't do that because only the primary treating physician is allowed to do so. So you'll always need to refer back to your primary treating physician who will refer those things for you. Right? Now, although you don't have the ability to refer yourself out to specialists, you do have the option and the right to choose your own primary treating physician. So if let's say, and this happens quite a lot, um, you suffered some type of low back injury at work. Let's say you were lifting something heavy and now you have low back pain, right here. It's not a emergency type of situation. So your employer tells you, okay, you reported this injury, you have pain, let's get you over to an occupational clinic, right? So they tell you, okay, this is where you need to go. You need to go to the nearby occupational clinic, and usually it's called urgent care or something along those lines. You go inside and they'll treat you very briefly, give you some medication, maybe take you off of work, right? And that's what they'll do for you at an urgent care. And most people, and I don't blame this misunderstanding, but most people don't understand that you have a right to choose who your primary treating physician is. Okay? You can choose your primary treating physician. All right? As long as that physician is in the network, you can choose who it is. You can always transfer your care to a treating physician within the network. You don't have to stay with a certain doctor for a certain number of days or for a certain time period. You can always change your doctor as long as that primary doctor is within the medical provider network. So I highly recommend that if you ever end up in a situation like this, where you've been sent to an urgent care and they provide you a treatment, they probably give you pressure, want you to stay within that clinic so they can keep billing the insurance company. I highly recommend that you get yourself out of there as soon as possible. Okay, and there's a few ways to do so. Right? So the moment after you get out of that urgent care. And the reason I don't like urgent cares, and I don't want to use a blanket statement for all urgent cares, there's probably some out there that are very of high quality, but the reason I don't like urgent cares is because I usually see them performing subpar care for patients. Right? You're not going to have the best doctors in here. You're not going to get the best treatment in here. You're better off getting yourself out of this urgent care as soon as possible. So, what are the steps you need to take for a transfer of care? All right, you tell this to your adjuster, they'll know exactly what you're talking about. So if you want to transfer your care outside of this urgent care, there's a few steps you'll need to take. One, you need to call your adjuster, okay, and tell your adjuster, hey, look, I'm not interested in continuing my treatment at this urgent care. I want to get myself out to a specialist or someone who is more reputable, has proven results for my type of injury. All right. And then once you tell them that, you ask for an MPN list. Okay. So you say, listen, I want to see a list of your MPN doctors within my area. So they'll either one, they'll give you a list, a physical list, they'll mail it to you or fax it to you, whatever is the most convenient. Or two, they'll give you a website in which you can pull up the website and look for MPN doctors in your area. Okay. So second, I would call, well, let's do this. Second, I would research the doctors that look, somewhat appealing to you. Research doctors in the MPN. Find out which doctors are reputable, have good reviews, have, an established reputation, have good experience. Find a doctor that you like and call that doctor's office and say, hey, do you take on new patients? Do you take on work comp patients? And will you act as my primary treating physician? Most of the time, if they're on the MPN list, they are willing to take on your case because that's how they make money. Right? Once you choose a doctor, call your adjuster again and say, I've chosen my doctor. This is who I want to treat with. Okay? Your adjuster cannot legally say, no, I'm not going to approve your transfer of care. Your adjuster has to approve your transfer of care as long as it's to a physician within their network.